Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Now I will explain the material about the human skeletal system. Now, let's get started. Skeletal system definition. The skeletal system function to form a rigid skeleton with attached tissue and organs. The frame of the human body is grouped into two parts, namely, this is a structure. Frame of the body consists of two parts, include first, axial skeleton, 2. Appendicular skeleton. Axial skeleton consists of 4 parts include first, skull bones, 2. Sternum, 3. Ribs, and 4. Spine. And now, appendicular skeleton. First, upper limb bone, and let's lower limb bone. And next slide. 1. Head sections. Parietal bone is forehead bone. Temporal and the bone of the head near the ear. This is 3. Occipital bone. This is cranial spine. 4. Sphenoid. Ace bone. 5. Ethmoid bone, the bone that makes the nose conversions. 2. The visual bones of the skull. First, maxilla bone, over there. Maxilla bone. Number 2, mandible bone. Number 3, zygomatic bone, cheekbone. Next, nasal bone or nose bone, and the lacrimal bone. The lacrimal bone is inside the nose. One more, maxilla bone, mandible bone, zygomatic bone, nasal bone, and lacrimal bone. One more, maxilla bone, mandible bone, zygomatic bone, nasal bone, and lacrimal bone. One last.
This is ribs image. Sternum, upstream bones or manubrium located at the top of the sternum, where the first and second ribs are attached. 2. Body bones or gladiolus, located in the middle where our ribs are attached to the rear third to the 7, the combined ribs to 8 to 10. Montage's word or siphon process. Located at the bottom of the sternum, there's a bone is formed from cartilage.
This uh, ribs image. The ribs function to protect vital organ in the chest area as the heart, lungs, and liver. And people have 12 pairs of ribs, which will be composite of 7 pair of true ribs, 3 pairs of false ribs, and lets 2 pair of floating ribs. And okay, we know appendicular skeleton um, consists of 4 parts include 1. Extremitas superior is first humerus, radius, and ulna, carpal, metacarpal, dan phalanges. For example, humerus, radius, ulna. Humerus, radius, ulna. Carpal, metacarpal, and this is itu that's it. Phalanges. One more: humerus, radius, ulna, carpal, metacarpal, phalanges. One more: humerus, radius, ulna, carpal, metacarpal, phalanges. And next, extremitas inferior. Example: femur, patella, and tibia, tarsals, metatarsals, and phalanges. One more: femur, patella, and tibia. Next, tarsals, metatarsals, and phalanges. Next, scapula or scapula. Next, bone of pelvis, girdle. Next slide. Types and kind of bones in humans. Compact bone. These bones are composite of collagen fiber called lamellar osses, which align each other at the edges of the bone surrounding the blood vessel. Spongious bone. The inner part of the bone is compact, as in the bone marrow cavity. In babies, this cavity appears red and produces a loud fall of blood vessel. In adults, the bone marrow cavity appears yellow and is filled with the fat cells. Cartilage. Example: hyaline cartilage, elastin cartilage, and fibrocartilage.
Okay, this is a human skeleton in the skull, facet, scapula, humerus. This is humerus, ulna, radius, pelvis, this is pelvis, femur, patella, tibia, fibula, tarsal, metatarsal, heinous, sternum, ribs. This is ribs, vertebral, ini, sacrum, carpal, metacarpal, heinous. Definition of bones. Bones are organs with heart and region structure that make up the human skeleton. The organs are dynamic and constantly changing, requiring stimulus for the development. Some bones can fuse and form stronger bones, and they occur during the growth period.
In babies, there are still many bones that are not connected to one another. For example, in a skull, if we touch the crown bone of the baby, it will feel soft because the skull plane on the baby head are not fused. The gap between the planes of the skull is called the frontal. As it grows, this plane will eventually fuse to form the skull bone. When the growth period is over, the number of human bones will be counted as 2000x.
What is ossification? Bone is forming from an ossification process that starts with the formation of cartilage, whole with high binding of a mineral by osteoid to become hard bone. The process of bone formation occurs at 8 weeks of the mother bone, or what is known as the embryo. While developed in the form of an embryo, the skeleton is made up of a cartilage which is formed from mesoid and calcareous. The process of bone formation occurs continuously, and it causes an increase in the bone size.
Bone forming process. Ossification is divided into two, namely intramembranosus ossification. Process occurs when the fibrous membrane is depleted by bone tissue. Intramembranosus hardening occurs only in certain flat bones. 2. Heterotrophic ossification is the process of replacing damaged cartilage by bone tissue. There are 5 processes in bone formation. Step 1. Formation of bone collar around hyaline cartilage model. Step 2. Cavitation of the hyaline cartilage within the cartilage model. Step 3. Invitation of the internal cavities by the peristyle bud and spongy plant formation. Step 4. Formation of the mineral cavity as ossification continues. Appearance of secondary ossification centrates in the epiphyse in preparation for stage 5. And last step, ossification of the epiphyse. When completed, hyaline cartilage remain only in the epiphyseal fateless and carticillary cartilage. Joints. Joints are interbony relationships so that bones can be moved. The relationship of the two bones is called joint articulation.
Joint structure, joint structure, joint type, grouping joint by motion. Joint structure. Ligament is the fibrous connective tissue and connect the bone with the other bone, and it can prevent excess movement of the joint. Capsule sandy, a fiber layer that coats the joint. Inside there is cavity. This is image normal joint. Hyaline cartilage. Cartilage tissue covering body and of the bone, useful to keep from impact. Joint type, fibrous joint, immovable joint, where the bones are very close together and separate only by the pair of a fibrous connective tissue, for example, between the skull bones. Cartilaginous joints, linear movement joints where the bones are connected by hyaline cartilage. Example, ribs. Synovial joint, the free movement joints are the large part of the joint in the adult body, such as the shoulder and pelvic joint, elbow and knees. Now in the bones of the finger and feet, wrist and feet. Joint basic on their mission are a group into movement, namely synarthrosis. Synarthrosis, synfibrosis, has a bone are connected by fibrous connective tissue. For example, joint of the skull bone. Next, Synaptoses in chondrosis, connected by cartilage. Example, spine. Osteoarthrosis. Syndesmosis. Bones are connected by connective tissue or fibers and ligaments. For example, joint between the fibula and the tibia. Symphysis. The bone is connected by cartilage tissue shaped like a disc. For example, the relationship between the spinal segment. Diarthrosis. Hanger joint, tidal joint, artery joint, plate joint, tear, joint elliptical joint, and joint.
Disease of the bone. Look at the picture. Scoliosis, lordosis, kyphosis. It's clear that there are structural differences in the spine, while the image below shows the difference between bones with osteoporosis and normal bones. Osteoporosis is loss of bone. Bone function. 1. Protects self-organ and tissue. 2. As a passive means of motion. 3. Where muscles are affected. 4. Places of formation of blood cells.
돌아서는 그 순간 벌써 네가 그리워 자고 안녕 내일 만나 oh yeah yeah 시간 이따 2시 거기서 우리 다시 만나자